Good evening, everyone. We'll start with the class. So, yeah, this Tuesday we could not have the class, and I could not inform earlier due to some network issues. Not join meeting. So, yeah, we rescheduled it for today. That's why maybe many people are absent today. Issues. The class is being recorded. Whoever is missing it, they can catch up later. So yeah, it's already 6:10. 6:11. We will start with the class. Whoever is present, they can participate in this session today. Okay. So yeah, we have a set of 21 questions today, and I will be showing you the question, and you given 3 minutes to think about the answer for that question, and you have to write it down in the chat box. Okay. I hope everyone one is new to the class. I hope you all have been attending my previous interactive sessions as well. And anyone is new here, I will introduce myself again. So I am Amrita. I am a PhD final year student at University of Hyderabad. Okay, and I take these live interactive sessions every Tuesday from 7 to 9 p.m. But this week's Tuesday class was postponed today. Okay. So yeah, so today we are going to discuss the previous year questions for week 5. Okay, we have already completed 4 weeks of interactive sessions. This is week 5, and I hope you all remember the rules of the class. You should not unmute your audio or video throughout the class. Okay, and yeah, keep noting down how many correct answers and how many wrong answers you are giving. We'll see at the end of the class. Okay. Okay, so let's start with the first question for today. Early skin to skin contact in the operating room is important for the mother and the newborn. True or false? Start answering. Okay, I guess everyone is done with the first question. Let's see what is the correct answer. It is true. So, early skin to skin contact is very important for the mother and the newborn as soon as the baby is born. So, here you can see the first embrace. Okay, a protected and prolonged skin to skin cuddle between the mother and the baby allows proper warming, feeding, and cord care as well. So, first of all, this first embrace is composed of the four key steps, which is drying of the baby immediately and thoroughly after birth, then early and sustained skin to skin contact between the mother and the baby until the completion of the first breastfeed, then appropriately timed clamping. Like we have discussed earlier, there should be a little delayed cord clamping and cutting of the cord, then initiation of the exclusive breastfeeding. Okay, I hope you all are familiar with the terms as we have already discussed in the previous weeks what is exclusive breastfeeding, what is delayed cord clamping, everything, right? Moving on to the second question. Milk from mothers of premature babies is rich in insulin, infection fighting proteins, oxytocin, sugar. Start answering. Okay, I hope everyone is done with the second question. Let's see what is the correct answer. It is B, infection fighting protein. So, the milk from the mothers of premature babies are rich in infection fighting proteins because they have taken birth before the uh, required time period, so the baby needs to be protected from all kinds of infections. So the breast milk helps protect your baby from infections, particularly of their gut. Premature babies are more likely to get infections, hence it contains hormones, nutrients and growth factors that help your baby to grow and develop, right? On to the next. Ensure dash of uninterrupted skin to skin contact in the immediate post delivery period. 30 minutes, 10 minutes, 1 hour, 20 minutes. Third question, everyone. Start answering. Everyone, please keep your audio mute. Is everyone done? Okay, let's see what is the correct answer. It is C, 1 hour. Okay, so 1 hour of uninterrupted skin to skin contact is needed post delivery period, right? We already discussed that skin to skin contact is needed in the first question. So, how much long it should be? It should be at least 1 hour. Okay, moving on to the next. What is the role of immunoglobulin A antibodies present in cholesterol? It acts as a food for good bacteria. It binds to the germs and prevents them from entering baby's blood. It helps the baby in passing the first stool, promotes the growth of new blood vessels. Start answering. Okay, I hope everyone is done with this question. The answer is B. It binds to the germs and prevents them from entering baby's blood. Okay, so here you can see different types of antibodies available in our body: IgA, IgD, IgE, IgG, and IgM. These are the five types of antibodies present, and here you can see the difference in their structures. And these are the properties. Every antibody has its different, sorry, every immunoglobulin has its different properties. IgA, it is found in mucus, saliva, tears, and breast milk, and it protects against the pathogens. IgD, part of the B cell receptor, activates basophils and mast cells. IgE protects against parasitic worms responsible for allergic reactions. IgG, secreted by the plasma cells in the blood, able to cross the placenta into the fetus. And IgM may be attached to the surface of a B cell or secreted into the blood, responsible for early stages of immunity. So our question was related to IgA, which is found in breast milk, and it protects against pathogens and infections, right? Moving on to the next. Which of the following options stimulates the baby to salivate? The smell of her hands, the smell of the mother, the smell of the outside atmosphere, the smell of the medicine. Please keep yourself mute. Do you stream dance? Please keep yourself mute. Is everyone done? Fifth question. Let's see what is the correct answer. It is A. The smell of her hands, the smell of the mother's hand stimulates the baby to salivate. Okay. Moving on to the next. Breast crawl should not be performed for which of the following babies? Unstable babies with low birth weight, babies who cry will well immediately after birth, babies born by natural delivery, babies born by cesarean delivery. Start answering. Okay, let's see what is the correct answer for this question. It is A. Unstable babies with low birth weight. Okay, they should not be allowed to breast crawl. So breast crawling means what? When they are left on the mother's body after birth to go to reach till the uh, breast. They should not be, that should not be done for the low birth weight babies, because they will be unstable and they can't move properly as a baby, a baby who has a normal expected birth weight, right? So it should be avoided for the low birth weight babies. Moving on to the next. Seventh question. A mother is doubtful about colostrum, which is the first milk produced by the breast after the baby is born. Which of these is not true regarding colostrum? Colostrum should be discarded and it shouldn't be given to the baby. Colostrum contains good fats. Colostrum is rich in vitamin A. Colostrum is creamy, white, or yellow in color. Very obvious question. I hope everyone knows the answer to it, right? Okay, let's see. Let's see what is the correct answer for this question. It is A. Colostrum should be discarded and it should be given to the baby. This statement is wrong about colostrum because it is needed and it should not be discarded at any cost, because it contains good fats, it contains the immunoglobulins which will protect the baby from infections. It is rich in vitamin A and it is creamy white or yellow in color. Okay. Next, a mother fed colostrum to her baby, soon after which the baby passed black stools. What should she do? Immediately inform the doctor, as passing black stool is a sign of infection. Immediately stop feeding colostrum to the baby. She should not worry, as colostrum helps clear out bilirubin from the stool. She should not worry, as colostrum helps clear out iron from the stool, which is responsible for the black color. Start answering. Okay. I hope everyone is done. Let's see what is the correct answer. It is C. She should not worry as colostrum helps clear out bilirubin from the stool. So there is no need to worry if the baby passes black stools because it is because of the colostrum which is helping out clear out the bilirubin from the stool. So bilirubin is a bile pigment present in the liver. So it is not. So the colostrum is no way harming if the baby is having black stools, right? Neonates necrotizing enterocolitis is a serious condition caused due to inflammation and damage in the liver, intestine, kidney, or lungs. Start answering, and then someone should explain me also what is neonates necrotizing enterocolitis. Like, what do you understand by the term? Okay, I hope everyone is done. Let's see what is the correct answer. It is B. Intestine. Neonates necrotizing enterocolitis is a serious condition caused due to the inflammation of the dam and damage in the intestine. Neonates means babies. So neonate is nothing but a baby, the newborn baby who has this enterocolitis. What? So there is a serious condition where there is inflammation and damage in the liver. So here you can see how what happens. There is the lining of, sorry, liver. I'm saying intestine. So the lining of the intestine is uh, having an inflammation which leads to this condition called necrotizing enterocolitis. Right? Okay. Moving on to the next question, 10th question. What is the correct definition of golden hour? It is the hour when sunlight is maximum during the day. It is the first hour of the newborn after its birth. It is the hour when a baby first starts eating solid foods. It is the hour when the baby smiles for the first time. Start answering. Okay, let's see what is the correct answer. It is B. It is the first hour of the newborn after its birth. It is the correct definition of golden hour. Right? Unlike the highlighted definition of golden hour is where it is called sunlight is maximum during the day, but in terms of maternal health and nutrition, it is the first hour of the newborn after its birth. Okay. Moving on to the next step. During the surgery, doctors sense a medical emergency related to the mother. Skin to skin contact in the operating room should be completed anyhow, may not be completed. Start answering. Everyone is done. It's a very simple question, anyhow. Okay, so the correct answer is B, may not be completed. If during the surgery there is some medical emergency for the mother, then the skin to skin contact, which we have been discussing from the first question for the baby and the mother, may not be completed and it should be avoided at that time. Okay, okay. Moving on to the next question, there are dash stages of behaviors of a baby after birth: 9, 8, 7, 5. Okay, let's see what is the correct answer to this question. It is A. There are nine natural stages of behaviors of a baby after birth. Here you can see what are the stages: birth cry, relaxation stage, awakening stage, active stage, resting stage, familiarization, suckling stage, and the sleeping stage. Okay, so you can go through the behaviors in detail when I provide you with the PPT. Okay. Okay. Moving on to the next, the IMS Act is considered violated if a food is promoted by any means specifically for children up to dash years of age. 3, 2, 1, 4. Start answering. Okay. Let's see what is the correct answer. It is B. The IMS Act is considered violated if a food is promoted by any means specifically for children up to 2 years of age. So, what is the IMS Act? An act to provide for the regulation of production, supply, and distribution of infant milk substitutes, feeding bottles, and infant foods with a view to the protection and promotion of breastfeeding and to ensure the proper use of infant foods and for matters connected therewith or incidental for the infants, right? So this act will be violated if there is any kind of food promotion for children up to 2 years of age. Okay. Moving on to the next. Animal's milk has a high amount of type of protein called dash, which is not easily digested by infants. Whey, casein, lactose, triglycerides. Start answering. The exam pattern most probably will be subjective plus objective. So I am not the concerned person who can clear your doubts related to the exams because I have not been given that responsibility for making the question paper or anything. You can write it in the discussion forum available at the NPTEL website onto if you have any doubts regarding the pattern of the exam. But as far as I know, you should go through your current year assignment questions, the previous year assignment questions which we are currently discussing, as well as the lectures given by Rupal ma'am. Those are the most important things. You should be thorough with everything. The questions will be objective plus subjective. Okay? No, the problem solving sessions will be Tuesday as given earlier. This Tuesday it was missed. That's why we had to reschedule it to Friday. But otherwise, again we are going to have the next class week 6 on Tuesday. Okay. won't be Friday again, it will be Tuesday. As much as possible, it should be on Tuesday. Only under some unavoidable circumstances, it can be postponed to a different day. But other than that, it is as decided. It's Tuesday, 7 p.m. Yeah, 7 p.m. Today it was rescheduled, so I had done it to 6 p.m. But generally, it will be 7 p.m. every Tuesday. Okay. Keep yourselves mute. Okay, let's see what is the answer to this question. It is B, casein. So animals' milk has a high amount of type of protein called casein, which is not easily digested by the infant. So casein forms this tough, hard to digest curd in the infant's stomach, whereas they whey forms soft, flocculent, easy to digest curds. So the amino acids taurine and cysteine are present in high concentrations in breast milk than cow's milk. These amino acids may be essential for premature infants. So the breast milk is always better than the animal milk, because in animal milk casein is present, which is very hard to digest by the infants. Other than that, it is always advisable to give breast milk till 6 months of age for the baby. Okay, moving on to the next question. 15th, dash is the same for all mothers and babies. IMS, breast milk. Start answering. Okay, let's see which is the correct answer. It is A, IMS. So IMS Act, which we discussed, is the same for both mothers and babies. Okay. 16th. In the longitudinal position for skin to skin contact, the baby's chest, abdomen, and legs should rest on the mother's lower chest, upper abdomen, upper chest, and neck. Okay, I hope everyone is done. Let's see what is the correct answer. It is A, lower chest and upper abdomen. So, in the longitudinal position, the baby's chest, abdomen, and legs should rest on the mother's lower chest and upper abdomen so that the proper skin to skin contact is done. Okay, moving on to the next. Colostrum is selected only until the first dash after delivery. Secreted. 2 to 4 days, first few hours, 15 days, 1 month. We all know what colostrum is, and yeah, start answering. Okay, let's see what is the correct answer. It is A, 2 to 4 days. Colostrum is secreted only until the first 2 to 4 days after delivery. Moving on to the next, a baby is not able to breast crawl effectively. This could be because he is incorrectly placed. In which of the following ways should the baby be positioned? The baby's back should touch the mother's tummy. The baby's hand should touch the mother's tummy. The baby's tummy should touch the mother's tummy. And the baby's sides should touch the mother's breasts. So people who are joining late, we are already going to finish. Today the class was at 6 o'clock, not 7. So yeah, if there was any confusion, I apologize because it was a problem from my end that we could not have the class on Tuesday. I guess you all were waiting, but okay. Let's see what is the correct answer. It is C. The baby's tummy should touch the mother's tummy. Okay. Then only we can see that the baby is correctly positioned for breast crawl, right? Then only it can crawl itself to the breast. Okay, next question. Dash present in colostrum is responsible for its yellow color. Omega 6, protein, carbohydrate, beta carotene. I hope you all have gone through these topics in the lectures. I hope you all are attending the lectures for every week because there only you can get the detailed information we are discussing for each question. Rupal ma'am has covered all the topics and she has designed these questions. So yeah, you should not miss out on any of the lectures. Okay, let's see what is the correct answer. Is D. Beta carotene. Beta carotene present in the colostrum is responsible for its yellow color. Breastfeed is a skill. It takes time and effort to learn or assist the proper breastfeeding technique. True, false. Yeah. Okay, let's see what is the correct answer. It is true. Breastfeeding is actually a skill and it takes time and effort to learn and proper assist the proper breastfeeding technique because the positioning of the baby and the skin to skin contact is very important for proper breastfeeding and not nipple feeding, right? Okay, last question, I guess. For premature babies, dash is very useful. Cradle hold, kangaroo mother care, football hold, sideline hold. I hope you all know about these terms, different types of hold. If not, we are going to discuss it in the next week, I guess. It is there for the next week. Okay, let's see what is the correct answer. It is B. Kangaroo mother care. For premature babies, the kangaroo mother care position is very useful. We will discuss in detail about these types of positions hold in the next week. Yeah, here I have written about the kangaroo care. So hold your diapered baby on your bare chest. Place a blanket over the baby to keep her warm. So what are the benefits of kangaroo care? So it is also known as the skin to skin contact for and has great benefits for all the newborns. And what happens through this kind of hold? Regulates the baby's heart rate, breathing, and body temperature, helps baby spend more time in deep sleep. It improves in the baby's weight gain as well, and increases the mother's milk production for breastfeeding. It increases the bonding between the baby and the mother, yeah, or as well as the father if they are having that kind of hold. Okay, So yeah, we are done with today's questions. They were pretty easy. Let's see what are your scores. Please write down how many marks you got, how many correct answers you have given out of 21. Okay, I can see many people got 21 this time. It's really good. There's no one who got less than 21. Everyone got full marks. Really? I don't think so. Okay, great. Okay, so we are done with week 5 and we are going to have our next session on Tuesday at 7 p.m. So please be on time. Disperse the class now if one has any questions. Okay, so next class is on Tuesday, 7 p.m. Okay, please don't get confused with Friday. It is on Tuesday next week at 7 p.m. Okay, thank you everyone. Yeah, bye. Thank you. Thank you.